If you are a medical doctor working in an average flow hospital in Nigeria, you are likely to see 10 patients a day. This means you are likely to see 5,000 patients in 2 years. And for these 5,000 people, you are going to be having an intimate relationship with them, a relationship in which likely no one has had with them in their life. Hello guys, and welcome to my YouTube channel. My name is Dr. Peter Audu. I'm a medical doctor and content creator currently working in Nigeria. In this video, I want to talk about a few things that clinicians and healthcare workers can easily begin to take for granted and forget as they go on in clinical practice. There is this story about an experienced doctor, an old fellow who came early to work and had a patient lined up for him. So when he got into his consulting room, his office, he went into the room and the first patient came, and in a matter of 5 minutes, he had already made his diagnosis and sent the patient away with prescriptions. So when the patient was going out, he went on to open his window to let fresh air come in since it was in the morning. And when he opened the window, he overheard a conversation between his patient, a man, and the wife who accompanied the husband to the hospital to come and see the doctor. And the husband, the patient that just left the room, said something in the lines of, he got the diagnosis right. Pity for the bedside manners though. And immediately, the old fellow, the doctor, he shut back the window and sat down quietly before seeing the rest of the patient. This story was actually culled from the preface of the Oxford Handbook of Medicine, I think the 8th edition or thereabouts. So it is true story that was related by one of the writers. And he said, the essence of having good bedside manners as a clinician is to reopen that window so that you can actually open that window and hear whatever comments your patients can make, even when they think you are not listening. Seeing 5,000 patients people in 2 years is a big deal. And when you have smooth manners to relate with these people, you are definitely going to make a huge difference in their life, and you are going to make a huge difference in their life nonetheless, but it's going to be a sustained difference if your manners are something that they can reference. Many patients don't see doctors frequently in their lifetime. Maybe at significant points of their life, they will have to see doctors. But you as a clinician, the default is to see people. And it's easy for you to get burnt out, for you to forget the dynamics, the smooth dynamics of seeing people, especially as you get skilled and more qualified. It's easy for you to just, want to quickly listen to the heart sound and confirm if really there's a third heart sound or if there's actually a murmur. And then you actually just go and then just auscultate the chest, not forgetting what you recited when you were taking your OSCEs, of screening the patient, of taking permission, of greeting, of establishing rapport, of having a chaperone. You can forget all that easily because you just quickly want to do something. And then there is this, recently I saw a poem, a reflection of a patient that he had to say to healthcare workers. When people are sick, you as well as I know that in their flight and fight and fright and freeze mechanism kicks into action. So the defense, the poor attitude, the bickering, the resistance you are going to feel when you exercise your duties is definitely going to reflect something you can actually anticipate. Granted, they are bad patients and we have all had our shares of quite toxic people, but I want you to also counter reflect that, knowing that if you are a toxic person, you are going to be a toxic doctor. And if your close friends or your relatives have ever told you before, have ever complained of one way or the other about your attitude, your relationship with people, I guarantee you that it's going to be amplified as you become a clinician, because now you are going to be having very close relationship with people, and some of these relationships are going to be intimate, and the fine details of courtesy, of sophistication, of rapport is going to play a huge role in your ability to actually do your work very well. Anyway, so what are those things that we can easily forget we can easily forget as healthcare workers? You can forget privacy. I've worked in Nigeria as a doctor for the past 3 years, and we practice the open ward system typically in most institutions in Nigeria. And the open ward system sometimes means a patient can be maybe 6 feet or less than that distance from another patient. And each of these patients have different backgrounds, different social status, and different lifestyle altogether. And they will definitely have different diagnoses. And this patient is lentiviral positive, and then you are counseling and you are talking, and there is no sense of awareness in your talk. You're so stuck in the facts and the non-compliance of the patient that you forget that somebody is intently listening. There's a curious something I found in the open word system. Immediately you take the screen to screen a patient, it's like you have called attention to yourself for everybody in the world to start looking at the patient and trying to peep into what you are trying to do, with the patient. But I want you to remember in that kind of situation, remember to use hushed tones. Remember to excuse the relative. Not everybody that comes to visit people in the hospital really care for them truly. Excuse them, excuse their kids, excuse their spouses if you have to, if you want to counsel patients, especially those that have sensitive information generally, and then in particular to those that have sensitive information when you discuss clinically with them. Still talking about privacy, you want to examine the abdomen of a lady. You are going to have to screen that patient. Even if you just want to check for two things, you just want to confirm the liver span. It's not going to take me 2 seconds to check. You just want to see if there is actually tenderness in the right iliac fossa. Screen the patient, take your time and do it. It's obviously going to take you a little longer when you want to do this, but the standard with which you would have adopted would go a long way in your practice, and it will also, the patient will never forget. He will always remember that doctor who took the extra care, who took the extra time, who took in Goldman's book, MD Goldman, when he wrote his book How Doctors Think, he said there was a study of doctors who are being sued, surgeons who were being sued, the ones that had the highest cases, lawsuits against them, and those that had not. And he said their consulting time, the difference in their consulting time was 2 minutes. Doctors who had less lawsuits against them saw patients with an average of 18 minutes and 24 seconds or thereabout, while those who had the highest lawsuits among them saw patients with an interval of 16 minutes. So just between a short period of barely 3 minutes actually plays a significant role in how patients actually respond in terms of lawsuits against doctors. So, and I'm telling you, attitude, beside the facts, attitude is going to play a huge role if you're going to have any negative consequence in terms of medical legal issues in your practice. Use a chaperone. This is generally for everybody, but in particular if you're a male doctor, you have to remember to use a chaperone. Let the mother stay back. Let a nurse be with you. Let somebody be with you. Not just for your sake, because of course you have to protect yourself. It's ethical, it's actually important legally that you have a chaperone with you when you're examining women. But it's more important for the patient, to make that patient feel more comfortable and make the patient respond more. Obviously, when you're working with younger patients, you are going to see how important this is. But even as you begin to work with more mature people, more mature patients, still remember to use a chaperone. At least offer one and let the patient decline, or make the patient as comfortable as you can within the limited resources and time that you have. Minimize pain as much as you can. If you know there is an alternative to pricking the patient more than once, please do take that alternative. If there's an alternative to an IM drug, to an IV drug, please take that route. Don't assume because he's a 40-year-old man with callous hand and you can see he works under the sun, he works manual job, and then the veins are popping, and then you think, I will just quickly do this and then do it again and then do it again. Everybody feels pain differently, and irrespective of the build and the physique of the person or your assumption of the person, you can easily assume that the patient is stronger than the patient actually is. If there is an easier alternative in terms of pain management, please take that alternative. Don't forget, that 70-year-old man with urinary retention could easily pass for your grandpa, could easily pass for your dad. So be, as they used to say, empathy, and is a skill that you have to learn and remind yourself often of. Because remember, you might have lost count of the number of IV lines you've set, or the number of urethral catheters you've passed, or the number of nasogastric tube you've inserted. But I assure you that these are very, very discomforting procedures. And even though you have become an expert at it, Do not take it for granted, because this is the patient's first intravenous fluid administration. This is the first time the patient is having an X-ray. This is the first time the patient is having to have been examined thoroughly by a doctor. So it's always the patient. Remember, it's always the patient's first time. So because you're an expert and you're so comfortable, extend that comfort to the patient so that the patient does not, feel totally out of water. Explain the diagnosis to the patient. You might not have the time or the language skill to be able to communicate effectively with your patient. I've worked in Nigeria for 3 years. Less than 20% of my patients were able to speak quality English enough for me to communicate to the depth in which I would have loved to communicate with them. But nonetheless, that's when you probably have to learn the language. Use an interpreter if you need to, because you will very likely need to use an interpreter. And then for the benefit of the patient, because you see, there's tiny things that could have been corrected but would have been ignored, and then the patient goes and comes back as a burden to you eventually again, but also because as a burden as a burden to the patient also. So think about all those kind of things. Henry Longfellow said something, that it is the smartest of physicians that cure illnesses. That the wisest physicians, they don't bother about curing illnesses, they prevent them in the first place. So when you have this at the back of your mind, it changes the philosophy from whence you practice. I think I would round up these things you can easily forget by talking about the last point, which I think is actually the most important point, which is treat your colleagues right, especially your younger colleagues. Some of the toxicities that we have that we can't see, we can't recognize, are those ones we unconsciously learned from toxic individuals and superiors. So please treat your colleagues right. There's this saying that says true kindness or your true attitude is known when you relate to people that have nothing to do against you. And your younger colleagues will fall into that category, as well as your patient. Treat your younger colleagues right. They're learning a lot more than stuff from you. They're learning a lot more than clinical practice from you. They're learning mannerism. They're learning bedside manner. They're learning interpersonal relationship from you. And the quality with which you treat them is going to have a ripple effect on the number of people they are going to train and the number of people they are going to treat. So you have to have that at the back of your mind when you are working with your younger colleagues. To push that point home, there is this famous experiment known as the Monster experiment, where orphan kids were taken. They were divided into two groups. Those that stutter, all of them stuttered, so they were divided into two groups, and then one half of those groups were teased and they were laughed at. They were jested upon whenever they stuttered, and the other group were rained praises and encouragement on, even when they make mistakes. And at the end of the day, the result of the experiment was such a disaster. They had to name that experiment the Monster experiment, because these ones that were jested upon, laughed at, and humiliated, they ended up being so bad, so they could not adapt to the society. Some of them committed suicide, some of them were incarcerated, and some of them could not even socially adapt and learn and fit into the society. That experiment was aptly named the Monster experiment, just because of the words and the kind of feedback those children got. And it has also been repeated in adults, in prisoners, and the results was similar. We do not really know the impact negative words have on the psychology of humans. Many people have come up with quite a number of theories and ways of renewing the mind and refreshing, but in the first place, there's no need to do the damage. Sarcasm is not the best way of learning. You don't have to make jest of your students' intellect before they learn. They don't have to always learn in the most toxic environment. Yes, those kind of challenges can spur some to learn, but the impact to others is quite negative, and we know that people learn more in more positive environments than when the environment is negative. On a final and very sad note, I'm dedicating this video to Dr. Tolu Alabi. Dr. Tolu Alabi, prior to his death, was a neurologist and one of the kindest doctors I've ever worked with. I worked under him as a house officer when he was a senior registrar, and even as a medical student, in several occasions I was in his unit, and we lost him tragically and suddenly a few days ago. He was an exemplary doctor when it came to this qualities that make a kind doctor, and we'll sorely miss him. Thank you very much, guys, for watching. See you in the next video.